What's the meanest thing a doctor or nurse has said to you? 1. 1 year ago I got bit 3 times by a copperhead. The ER staff was mocking me. I said I was very nauseated and asked for something to throw up in. I also was sweating profusely. They laughed and said you're just having a panic attack. I not so nicely yelled, well, you would be panicking too if you just got bit by a copperhead 3 times. I proceeded to throw up all over the hallway and even managed to hit a few nurses with some. The drive came in and refused to even look at the picture we managed to catch before the snake slithered away. She refused to contact the state snake ID site or poison control. I was just drug seeking or overreacting. She refused transfer to the nearest trauma hospital over an hour away. My hubby helped me out to the car where we decided to drive me to the trauma center. When we got there was a swarm of people immediately taking care of me, starting IVs, calling the trauma surgeon, drawing blood and more. They looked at the pic of the snake and said, yep, that's a copperhead. Because I had been bit in the big toe twice and the heel once, they carefully evaluated the degree of swelling. My entire foot was swollen. Swelling was now above my knee heading to my upper thigh. Poison Control recommended antivenom because the bite now involved 3 joints. The fact that I'm diabetic with nerve damage to my feel was also a big factor. The local drive said my diabetes didn't matter. The trauma center was worried about me losing my leg. I was immediately admitted to trauma ICU where I got 4 vials of antivenom costing $83,000, not counting anything else, in the total bill of $103,000. I stayed 2 nights and was released to home. I needed a walker for about 2 months. I could only wear oversized Crocs for a cool of months due to the swelling. I actually got married wearing the Crocs and changing into oversized flats for the pictures. I notified my local hospital of being admitted to trauma ICU and needing antivenom. I never got a response, but I did get a $10,000 bill for 2 hours in the ER. Sorry, I can't find a picture of my foot. The meanest words were the RN saying you're just having a panic attack. 2. A few years ago I was really sick. I kept getting UTIs like 2 or 3 times a month. I had gone to doctors who had dismissed me as having too much sex or that I didn't clean myself well after the bathroom. Neither was the case. I eventually landed at urgent care again on a Friday evening in tears because I had yet again another UTI. Thankfully the doctor eased nice that night and she sent me home with antibiotics. But something was wrong. A few days later my right side was hurting and the antibiotics weren't helping like they should have. The urgent care doctor called and said she had made me an appointment with a urologist in town. He was the only one available on short notice. My cultures had come back positive with a strain of E. coli called Espel. It was resistant to all oral antibiotics and I needed to see a urologist ASAP. So I went to the urologist and I was emotional because I was scared. They made me do another sample and after I tell the doctor why kidney really hurts, he told me to stop being hysterical. That the urgent care doctor didn't know what she was talking about and I didn't have an infection. I just needed to go on a diet and lose some weight. He even referred me to a psychiatrist. Well, freaked out I went home and my boyfriend took me to the where all they could do was refer me to an outpatient clinic for a 7-day course of shots for an antibiotic called Invents. I went got the shots and kinda felt better, but something was still off. 1 week after finishing the shots my BF says you rolled to hug him and I burned him. My fever was so high I wasn't fully responsive. He grabbed me and drove me to the hospital. Turns out the shots only masked my symptoms, didn't cure me. I was now septic with a super resistant strain of bacteria. The doctors had a hard time bringing down my fever, which was 105 when I got to the I don't remember because I didn't wake up for 5 days. By the time I woke up I had several lives go bad and my veins were shot from the infection. I had to get a PICC line. I lost 30 pounds in a month and spent most of that in hospital. I recovered but not before I lost some function in my right kidney. All because I had a doctor that was a total ass. I now have PTSD from the experience. And it turns out my estrogen was low, which is why I was getting the infections in the first place. But no one tested my hormones because I was in my 20s and too young for that test. 3. I became pregnant at an early age. When I went into the hospital to deliver I was really scared. In 1973, in the hospital where I delivered my son, no one was allowed with me in the labor room. I was scared and not sure what was going on. I could hear another woman in labor yelling. I was crying silently but trying really hard not to. A nurse came in to check on my progress and tears were rolling down my cheeks. She said to me in a hateful tone, "Stop crying!" It doesn't hurt that bad. That made matters worse. A few minutes later a different nurse came in and stroked my hand. She said, "Honey, don't listen to her. She has never had a baby and I have had 6. You are doing great." An hour later they were sending me down to x-ray because my labor was progressing but my cervix was not. I think I finally relaxed knowing I was being taken care of, and delivered my son in about an hour. Never saw that nurse again the 4 days I was in the hospital. 4. Not necessarily to me, but about me. A few years back, maybe 6 months before COVID hit in the US, I was suffering from a sore throat. I figured it was just a normal cold, maybe a flu, and left it alone. I took the usual medications, had some cough drops, some throat spray, the whole 9 yards. It kept getting worse, though, and the longer I waited, the more agonizing it got. Eventually, I hit the point where I was in tears even swallowing my own saliva, and I hadn't eaten or drank for a few days. At that point, I needed help. It was late at night and my insurance was decent, so I caved and went to the hospital. At the hospital, they threw me in a room and left me alone for hours without even a hello, "I'm your nurse." When a nurse did eventually come in to take samples for a strep test, she rolled her eyes at me and left pretty quickly. It was another 3 hours before I pressed the call button, and another hour after that before anyone even popped their head in to check on me. I was frustrated and sick, so I was once again in tears. I generally have a pretty high pain tolerance, but my entire body hurt and I truly felt like death at the time. Crying was my only outlet, even though it just made me feel worse. I had barely calmed myself down when I heard the nurses in the hallways talking about me. I remember distinctly what my nurse said, and how all the other nurses laughed afterwards. "Oh, is that the patient in room 4 again? If she wants to be such a crybaby, maybe I'll send her to the fucking pediatric ward." Christ. Someone came in soon after that to tell me I was negative for strep and just had a little sore throat. I was too weak and upset to argue, and just went home. I wasn't offered so much as a cough drop. The next day I landed myself in a different ER, where I explained what had happened. They ran some basic tests that should have been done at the other hospital, which included rerunning the strep test, and found out that I had been suffering from toxic shock syndrome. I think I'll always be a little salty about that one. 5. I had one snooty physician's assistant who made it known that she didn't like her job. I had to go to several clinics she worked in as I have a terminal illness that I received treatment for. At my last appointment the doctor wanted me to come in to get a consult for a neurosurgery for a cyst on my cervical spine. Apparently neither that doctor nor myself knew it was inoperable. Anyway, 6 weeks later I showed up for my appointment and was waiting in my room, which was usually a 30 minutes wait after at least a 2-hour wait in the waiting room. This PA walks in, looks at my chart and doesn't say a thing but walks out of my room and very loudly says this is a complete waste of my time. Talk about pissing me off. I just drove 1 hour, sat in a waiting room for 2 hours and sat in the exam room 30 minutes only for her to say I was a complete waste of time. With tears in my eyes, I got dressed and just left without saying a word. I filed a complaint with the clinic only to have them answer that you must have misunderstood what she said type form letter. That pissed me off even more, so I filed a complaint against her license. From that point on, if I got stuck with her in a clinic I always requested someone else. I don't care who the person is or what the problem is or if you like them or don't like them, it is never okay to say someone is a waste of time. Completely unprofessional.